Good morning, everyone. I've asked our Health Commissioner and participating agencies to join me today to provide residents with another update on our efforts around the coronavirus. We're taking the situation very seriously and have been pleased to date with our emergency preparation. I have made clear to every agency here that the coronavirus is our top priority. We will prioritize the health and safety of our residents. Just yesterday, I gathered the city's emergency personnel, agency representatives, and cabinet officials for a tabletop exercise related to the evolving coronavirus. We ran through 3 exercises to help ensure the health and safety of our residents and our visitors. And we've had several cabinet meetings dedicated to this topic to make sure that agencies are coordinating and that we're working collaboratively with our state partners and local hospitals and academic institutions. We have provided weekly updates and will continue that practice moving forward. We'll add additional briefings as needed. We will also postpone the planned State of the City address because preparing for coronavirus is our top priority. And today we're releasing the city's emergency response plan for human resource issues related to the COVID-19. The city also has an emergency operation plan, and each agency has submitted a continuity of operation plan related to the coronavirus. We'll also continue to update these plans as the situation evolves. City staff is also creating an operation dashboard to track our effort, preparedness, and core operational function related to the virus. Dr. Jarasas will speak, and then she will introduce Chief Ford.
Good morning. Thank you all for joining us this morning. The Baltimore City Health Department has been working closely with other members of Mayor Young's cabinet as we prepare for possible coronavirus cases in Baltimore City. I'd like to thank Mayor Young for his leadership as well as my fellow cabinet members for their support. As of this morning, there have not been any reported cases of COVID-19 in the city. Today, I will be providing an update from the CDC regarding travel and reviewing what everyone can do to prevent the spread of coronavirus and other respiratory illnesses. COVID-19 guidance continues to be updated almost daily by the Centers for Disease Control and Prevention as we continue to learn more about the novel coronavirus. For the most up-to-date information, residents are urged to check cdc.gov, health.maryland.gov, and health.baltimorecity.gov. Many employers in the Baltimore City region have reached out to the health department seeking guidance on policies for workers who may have traveled abroad recently. The CDC has recently clarified its recommendations for those seeking to return to work. If you have recently traveled to a Level 3 CDC travel advisory country that has widespread ongoing community transmission of COVID-19, we are asking that you stay home for 14 days from the time of your arrival back into Baltimore City to self-monitor for symptoms. As of March 11th, those specific countries are China, South Korea, Italy, and Iran. Returning travelers should take these steps to monitor their health and practice social distancing while isolating themselves for 2 weeks. Take your temperature with a thermometer 2 times a day and monitor for development of a fever greater than 100.4. Also monitor yourself for cough or trouble breathing, and if you are concerned about the progression of your symptoms, please call your healthcare provider for further direction. Stay home and avoid contact with others. Do not go to work or school for that 14-day period. Discuss your work situation with your employer before returning to work. Do not take public transportation, taxis, or ride shares during the time you are practicing this social distancing. Avoid crowded places and limit your activities in public, as well as keep your distance from others to at least 6 feet. We encourage all residents to make sure they are limiting the spread of respiratory diseases by engaging in personal protective behaviors. This includes washing your hands frequently with soap and warm water, or using an alcohol-based hand sanitizer. When coughing or sneezing, covering your mouth and your nose with a tissue or sleeve, and throwing that tissue away and washing your hands afterwards. Avoiding touching your eyes, nose, or mouth. Avoiding close contact with people who are ill, and if you are ill, staying home from work or school. Thanks again to Mayor Young and my fellow agencies. I'd now like to turn it over to Chief Niles Ford of the Baltimore City Fire Department.
Good morning. I want to give you an update on the fire department as well as 911. As you all know, the 911 reports to the fire department, so I'm going to begin there. 911 has established a set of protocols, best practices to try to provide as much information for the caregivers, the responders, to ensure that they're aware of what they're walking into, to put them in the position and when they deal with situational awareness, that their situational awareness is an informed situational awareness. And for all practical purposes, other agencies have duplicated that process because we were well ahead of many other agencies. From a response standpoint, from the fire and EMS standpoint, we deal with issues all of the time. So we train our people how to be safe, how to respond, and actually wear the proper protective equipment when they respond to these calls. That's the reason why it's very important on the front end that when our citizens call and need help, that they are completely accurate about the circumstances that they have, so we send the proper resources and that our people are prepared in that environment and they're prepared to provide service for the community. We've been going through training. We have had and updated recently a pandemic, basically a basic coup plan. So it's not new to us. This is something we've done before. One of the things we do want to ask the community is to, as this situation progresses and goes through all the evolutions that it's likely to go through, we need our citizens to be aware that from a very basic standpoint, 911 is an emergency line. If you have other issues that you're concerned about, there are other things that you can call, for example, 211. But when you have emergencies, you call 911. If people use the system in an improper way, as we evolve into what we think we could possibly evolve into, they could exacerbate our system. And we want to be in the position that if someone has a heart attack on the west side of Baltimore, that we have the resources to send them to that call. So we want people to be conscious of that. Again, we have trained our people to be very effective in this environment. This is part of what we train for. So we're prepared for that, and we're actually continuously meeting with all of our partners. We're having conference calls, even as far as West Coast, to learn best practices and things that they've had to deal with, the best decisions they've made, as well as some of the ones that if they could go back and change, they would change. At this time, I'd like to introduce the superintendent of schools.
Thank you, Chief Ford, and good morning, everyone. With regards to city schools and our preparation, we have been working very, very closely with the Health Department, Baltimore City Health Department, and under Dr. Duraz's leadership, we are following as well the advice of the CDC. We are encouraging families with sick children to please keep them home in the event of them becoming ill. At the same time, employees who are sick are also being advised to stay home. As of last Friday, we officially canceled all school and district-sponsored out-of-state and international travel for both staff and students from now until June 15th, as things currently stand. On Monday, Governor Hogan also curtailed all of out-of-state travel for state employees, and now many LEAs across the state over the last day or so are following suit. We have issued instructions to school leaders and custodian supervisors for cleaning and disinfecting schools. We have increased our attention to high touch points in schools, so doorknobs, handrails, areas in schools where young people tend to put hands and everything else, quite frankly. What we are also doing is we have developed an internal team in the event, and I just want to say again, in the event, there are no known cases of COVID-19 currently, but in the event that there is a case within a school, we have a team ready of some of our best custodians around disinfecting a building in the event that we have to go to that level. Operations has been ensuring that all buses are being cleaned and sanitized twice daily. And we have also ordered significant additional supplies so that schools, teachers, anyone who does not have soap in their building can email our communications department. We pass that on to operations. I, by the way, have received some direct emails. I will tell you it is faster if you actually email the communications department, and we will deploy some of our operations teams to make sure that all schools, particularly those with low supplies at this point of the year, have access to soap and gloves and other disinfecting agents. Our communications department, again, has worked with the health department, and we've established a health update section for city schools families on our website that we update daily. The district continues to work with the health department with regards to any possible or potential closures of school. We are also working very closely with the city's emergency food working group to be able to identify the safest approach, a coordinated approach to the feeding of children and families in the event of school closures. And now it is my pleasure to introduce Quentin Herbert from the Labor Department.
Thank you and good morning. I'm Quentin Herbert, Director of Human Resources. As the mayor alluded to earlier, we do have a comprehensive personnel plan that will be published later today. We do have a telework policy as social distancing measures become more necessary, and we're following the direction of Dr. Jaraza and the health department in that regard. We also have looked at relaxing some of our leave policies and other policies that we have to ensure that our employees who are sick can stay at home. Employees who need to stay at home with sick children can do that, and we're being more flexible with our employees to ensure that they have that ability to stay home when necessary. And again, we will publish that plan later today. It will be available on the health department's website, and we will also publish it on our website as well.
Thank you, everyone, especially our health commissioner, who has done an outstanding job taking the lead and ensuring Baltimore is prepared in case of an outbreak. Any questions?
What's the trigger point
For
sending employees home and say stay home, for closing schools, social distancing is widely seen as the single most effective tool to prevent really rapid spread, and it's clear that COVID-19 spreads really rapidly. So what's the trigger point? Is it 3 cases? Is it?
So I don't know that there's necessarily a number of cases. Certainly, we're looking at community transmission as something we would consider, whether it's on a low level or if it's widespread. Thus far, the cases in Maryland have been associated with travel. So we'll certainly be watching over the next few days. And the decision will be made on a case-by-case basis as we potentially see community spread in other parts of the state, or if we potentially see a case in Baltimore City.
Do you know how many testing kits are available?
I don't. Unfortunately, when it got rolled out to state labs or when it got rolled out to private labs, I don't have the exact number.
Do you know how many tests are being done in the city of Baltimore?
I do.
What's that number?
So that number I'm not at liberty to share, but I will say that we're working closely with the Maryland Department of Health, that if there is a concern for a case or a person that needs to be under investigation, that we do the appropriate contact investigation for that individual. I will also say that, again, with it being rolled out to private labs, initially when it was going to the Maryland Department of Health or CDC, we were much more aware of the number of tests that were going out. But with it being rolled out to private labs, we may not know necessarily every single test until the result comes back, and it is reportable to the health department as a communicable disease.
Why is that not a public number? How many tests are being performed?
So how many tests are being performed? So again, I think that private lab, so the fact that there are tests being rolled out to private labs, we don't necessarily have all of their numbers, though we can find out the numbers that are at the state level. But certainly the Maryland Department of Health may be able to release that information.
What kind of resources do you have in place for contact tracing should any cases be confirmed in the city?
So our Office of Acute Communicable Diseases is where we do any type of contact investigation, and we have a number of workers who would support that investigation.
Anything else? Well, while this is happening, like, the media has gotten a lot of criticism for how this virus is being covered. Some people say that there's a bit of an overreaction. What would you say to that, especially with everyone gathering here today and talking about how the city is moving forward? What would you say to that for people who feel like this may be much ado about nothing?
So certainly, if there is a case of a pandemic, I think that everyone should be informed. I think the biggest thing is to put out accurate information, and so really looking to sources of truth, cdc.gov being where we look for our source of truth, Maryland Department of Health, as well as our website. So I don't think there's anything wrong with sharing the information. I think we just want to make sure that we're sharing accurate and up-to-date information.
And as far as all the steps that are being taken as well, I mean, you're seeing events that are being canceled and whatnot. Do you see that as being an overreaction? What would you say to people who feel like there's so much of a concern for canceling things? What would you say to people to give them a reason why these things are being done?
Yeah, so again, I mean, we look to the CDC for guidance around cancellation of events, and we know that it needs to be made on a case-by-case basis based on the event organizers, and do they have an emergency preparedness plan in place? Are they putting the measures in place to protect people who could potentially attend the events? So again, really looking to the CDC for guidance on whether or not an event should be canceled.
Can I ask Dr. Settlements a question? So we've seen that institutions in the university system of Maryland closed for 2 weeks at least.
Sure.
So I think you're probably getting asked this question, well, if the universities are closing, why aren't the schools closing?
Sure. Well, I think one of the things, one, is we are taking, excuse me, our lead from the health department. Number two, I think it's important for the public to understand that the dynamics of a university system, the size of the University of Maryland with young adults and faculty in residence is a very different setting than K-12 buildings that by and large are emptied every day. We have the ability to clean regularly. It's a different educational setting.
You mentioned that you're looking at taking the safest approach to feeding families if schools close, so children would continue to get meals if schools were to close. Is that what you're saying?
Yeah, and that's what we're working on again with our partners in the city. So I actually, if you want a coordinated citywide answer to that, I will defer to my colleagues who are coordinating that effort.
Okay, can she go?
Sure.
Absolutely can.
Good morning. I'm Holly Freistoff, Food Policy Director for Baltimore City. We have activated our Emergency Food Working Group. It's 12 city and city agencies and key nonprofits who are working on food distribution. We're developing out strategies right now for feeding kids in the event that schools should close, whether it is isolated environment or larger. We're working on senior feeding, and we're also looking at, because we have a large percentage of adults and families who are food insecure who are on SNAP, food stamps, we're also looking at how do we look at food distribution, since many of them cannot buy online because SNAP is not allowed online or being able to use it with cash. So we have a coordinated approach, and we're going to be monitoring and working on plans daily. Thank you.
What are some of those plans look like?
So the plans are, school closure is one. And so the food service director for the school district is on calls. I think there's a call actually today with all food service directors looking at what are their approaches. So so if schools were closed, we still will be modifying how we do congregate feeding, right? So we have congregate feeding where everyone would normally come if there's a snowstorm or so forth. We're going to modify that approach. So people will still be able to get fed, kids will still get fed. We're looking at the correct approach to kids feeding. Seniors, we're looking at how do we get meals to their houses.
What's the estimate in Baltimore City of a vulnerable population?
So 166,000 residents are on SNAP. I think that's the best approach for looking at vulnerability as far as food insecurity goes.
And in terms of health, we have a homeless population, we have a high poverty rate. In terms of folks that have difficulty with access to health care, what's the percent of the city's population that could be at high risk?
I would have to look up that information and get back to you, but I agree with your point that we know that we have a highly vulnerable population and at-risk population, and we'll target our efforts based on that.
Does SNAP cover hand sanitizer? So,
Does SNAP cover hand sanitizer?
So I didn't hear that part. So SNAP covers all food items.
does that cover hand sanitizer?
Food items. So I would say that's what I know right now is SNAP covers all food items.
All right, thank you, guys.
Okay. Next, I'm joined by Councilman Z. Cohen and Tisha Edwards. Zeke is here. That's okay. That's okay. Director of my Office of Children and Family Success. They will also serve as co-chairs for the newly established Trauma-Informed Care Task Force. As of today, residents can apply to be a member of the Trauma-Informed Care Task Force, and that application will be open until April the 10th. To apply, please visit mayor.baltimorecity.gov, then click on the Boards and Commission tab on the left. This task force was created by the recent Elijah Cummings Healing City Act, sponsored by Councilman Z. Cohen, and I signed the legislation into law on February the 9th. The Trauma-Informed Care Task Force will create a multi-year strategy that will inform city policies and procedure to align with trauma-informed care best practices. The task force will oversee the implementation of the plan and coordinating training of city employees in every agency and community groups. And now I ask Councilman Cohen to come up and talk more about the task force. Come on, Jay.
I want to begin by thanking Mayor Young for his support on this legislation and his commitment to eradicating trauma throughout our city. We're here to talk about another public health crisis facing Baltimore, one that has been around for much longer than the coronavirus, and that is trauma. We know that 56.3% of children in our city will experience one or more major traumatic events. And we know that that impact, if there is not proper support, can be lifelong. It can cause health problems. It can raise the likelihood of someone becoming substance use disordered, addicted, themselves being a victim or a perpetrator of violent crime. So we know that in this moment for the city of Baltimore, it is absolutely critical that we full-on address this issue of trauma. And we also know that government alone can't do it. It's got to be a community-based effort. That's why I'm proud to stand here with our entire Healing City Coalition. And that's why I'm excited today to announce with Mayor Young, the application for the Trauma-Informed Care Task Force. This is an opportunity for members of the public to apply and participate in this important work, to guide the implementation of the Elijah Cummings Healing City Act, and to really take this movement for healing to the next level. And I just wanted to close my remarks by saying, the other day there was a horrific shooting in Baltimore County where multiple young people were shot and one was killed. And that is awful and unacceptable no matter where it happens. But one of the things that really hurt my heart was that a county councilwoman said, you wake up and hear about this in the city, but never in the county. It's tragic, it's sad. Anytime we have another life lost in Baltimore County is tragic. Anytime we have a life lost anywhere is tragic, whether it's Baltimore City or Baltimore County. And let me just say this, Mayor Young, you know who came out and responded when there was that horrific shooting in Baltimore County? It was the Baltimore City Trauma Response Team led by Dr. Humphrey over here. They came out, they supported the victims, they supported their families. They didn't care that the children lived in Baltimore County. It wasn't about this jurisdiction, our jurisdiction. It was about how do we help and support people. And so I'm really proud to stand with these folks in the work that they've been doing. And we absolutely know that in this moment, it cannot be the city, the county, it has to be all of us working together for healing. So again, I thank you, Mayor Young and Director Edwards, for your support. Of course, Commissioner Jaraza, who is all things at all times right now. But this is a really important moment for our city, and we are excited to open up this task force.
Thank you, Councilman Cohen. Any questions about the Trauma-Informed Care Task Force before the councilman leaves us? Also, I want to thank Councilman Cohen for introducing a resolution around our census outreach efforts. Invitations to respond to the census will begin arriving in your mailbox this week. However, you do not need the invitation to complete the census. You can go to my2020census.gov and fill it out now. I did mine this morning. The online form is available in 13 languages. You can respond to the census online over the phone or complete the paper form. Responding by phone allows you to respond in the privacy of your own home, even if you don't have a computer. You can have someone walk you through all of the questions and offer any assistance you might need, whether it's language assistant or understanding what a question means. The phone number is 1-844-467-2020. Again, 1-844-467-2020. When you call or go online, you will be asked for the 12-digit code that is printed on the invitation you will get in the mail. You do not need this code to complete the census. It just makes it a little faster if you have it available. Completing the census is easy, and it only takes 10 minutes. And trust me, it took me 10 minutes. We want everyone in Baltimore to complete the census by April the 23rd. If not, the Census Bureau will send staff to your home starting in May. Most people don't want anyone knocking on their doors, so the best way to prevent that is to complete the census on time and fully. And also make sure your neighbors do the same. Completing the census is safe, and once submitted, your information is protected and completely anonymous. Your information cannot be shared with agencies like the FBI, IRS, local police, or ICE. Most of all, completing the census is important. For every adult, child, and baby not counted, over $18,000 is lost in federal funding for programs like school lunches, disability service, unemployment, roads and transit, Section 8 housing assistance, just to name a few. The city has partnered with nonprofit and trusted messengers to reach those who have historically been undercounted. Children are one of the most undercounted population. We need your help making sure we count every child in the city of Baltimore. It doesn't matter if the child is staying in a unit where they aren't on the lease, or they are staying with someone who isn't their parent, but maybe living with their grandma, or they are sleeping on a friend's couch for a few months. If the child or anyone is sleeping under your roof on April the 1st, they need to be counted. We absolutely have to count all of our children. Councilman, do you want to add anything?
Just that, we know that Mayor Young, Senator Mikulski, the City Council have all been very, very clear that this is critical for our federal funding and our representation. Baltimore's lost a lot of population, so it is critical that everyone turn out. One of the things that Senator Mikulski said at our luncheon is that there has been this effort to suppress the census and to make folks in cities like Baltimore scared. We know we have a large population of returning citizens, immigrants, and other hard-to-count populations, but it is absolutely imperative that people understand just what Mayor Young said, which is that the data will not be used to do any harm. It is illegal. It's a huge penalty if someone shares your data. So we need to make sure every single person in Baltimore gets counted.
Thank you. Any questions about that?
Yeah. Zeke, if we could ask you a question just in terms of the trauma program.
Yeah.
What are you looking for, and how those people who are applying, what can they do to help? Like how will they be able to help?
Yeah, so the legislation names 36 people to the task force. Several of them are agency representatives, and then there are several people from different communities throughout the city. So for example, we have clinicians, pediatricians, we have one returning citizen. We want folks who are proximate to trauma to be part of guiding this legislation. We have students, we have parents, folks from city schools. So again, the website goes up today, right now. We want anyone who is interested in this topic to apply. Ultimately, Mayor Young and President Scott select the members. They then go through the Executive Appointments Committee, but the task force is going to help guide implementation of the legislation. Director Edwards and myself are the co-chairs, and the idea is that both in working with the city agencies, as well as designing interventions within communities, this is a group of people from all different walks of life throughout our city that are coming together to support this work to reduce trauma. So really, it's about all of Baltimore coming together to have a Healing City moment.
Has there been any discussion with council people, anybody in Baltimore County government, et cetera, about this kind of effort? In other words, so it's not just limited to the city of Baltimore.
So we're really excited, Jane, that Senator Carter introduced a bill in Annapolis that in some ways mirrors the legislation of what we are doing here in Baltimore City. And I felt really privileged to go up last week with some of the folks standing behind me to go testify in support of that legislation. Because you're absolutely right. This challenge, this problem, this issue is not limited by borders or boundaries. It is not just a Baltimore City problem. Just like the opioid crisis, just like issues around violence, trauma is in Rosedale, it's in Prince George's County, it's in some of our rural and suburban counties as well. And so we hope to set a national model here in Baltimore. I do believe Baltimore is the largest city in the country to actually legislate around this issue. But we know that, like I said, Senator Carter has taken this bill up in Annapolis, and we do hope to see, and we've had a lot of interest already from other jurisdictions that would be interested in working with us to do similar legislation and similar community-based efforts to make sure we're addressing this holistically.
Thank you.
Thank you, guys.
Thank you all.
Thank you, Mayor Young.
Thank you, Mr. Young.